Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, and I offer online psychotherapy for anxiety via Skype. So if you're interested in learning more about online psychotherapy for treating anxiety disorders, whether that's generalized anxiety disorder, social anxiety disorder, or if you have a problem with recurrent panic attacks, or if you suffer from a driving anxiety disorder, or a phobia in general, then please go to my website and learn more about this online psychotherapy service that I offer. If you're interested in online psychotherapy, you should check that the therapist is able to provide sessions via Skype. I believe it's essential that you are able to see each other as well as speak to each other because this greatly improves the effectiveness of communication, and that's a very important factor when you're working with difficult emotional conditions like anxiety and panic attacks, or depression as well, or even for work with addiction. Many people like online therapy because it's clearly more convenient, and if you're living abroad or in a rural area, you might find it difficult to find a local therapist that you want to work with. People like the greater privacy also offered by online psychotherapy. It means that you can conduct your sessions from home and in the privacy of your own environment, and that's quite important for a lot of people. Sometimes we feel uncomfortable talking about our emotional problems. If it's an addiction, it's often very difficult to talk about that in a more public setting. Being able to talk about your anxiety online is much less intimidating for most people. So that's one of the additional benefits of online therapy via Skype. The style of psychotherapy that I offer online is called mindfulness therapy, and this is a particular approach that I developed many years ago now that has proven to be incredibly effective for helping people manage anxiety disorders. It's a technique that uses mindfulness. Now, mindfulness is simply a way of focusing conscious attention on emotions and on thoughts and memories and other components of the mind. It's a way of becoming conscious, but without becoming overwhelmed or consumed or lost in anxiety or depression or any other emotional formation. We have to build a conscious relationship with our emotions. That is an absolute requirement for them to change, in my opinion. Talking about your anxiety can provide temporary relief, but it's seldom as good as actually building an internal relationship with your anxiety, in which you spend more time, if you like, listening to it rather than reacting to it or trying to explain it away or try to understand it. All of these forms of cognitive processing are really taking you away from the emotion itself. I think it's much better to see the emotion directly and look at what can help it change itself, helping it to heal, And that's a very important focus of mindfulness therapy. It's helping emotions heal directly, immediately, by building this conscious relationship with them. And the best analogy is to think about what you would do if you were helping a friend or a child that was in pain, suffering, upset about something. You really want to establish a direct conscious presence, first of all. It's a way of establishing trust. It's a way of creating a safe space in which the person can explore the structure of their own emotions. And that's absolutely essential. And that's what we do with our emotions when we bring mindfulness to them. We create a safe space around our anxiety. And we begin to explore how that anxiety works. One of the most important things we first focus on is the constellation of reactive thoughts that feeds that anxiety. So anxiety tends to lead to proliferation of anxiety-based thinking, and this in turn feeds the underlying anxiety and creates this vicious feedback loop that stops the anxiety healing. So the first part of mindfulness is all about learning to see these reactive thoughts and breaking the unconscious habit of becoming lost in those thoughts. So we're not indulging the anxiety. Instead, we're simply creating a conscious and non-reactive relationship with it. So this is technically called establishing equanimity with your anxiety or other emotions that you're working on during mindfulness therapy. We build equanimity. That means we're able to have a conscious relationship with the emotion without reacting in any way. Even labeling it is a form of reactivity. Trying to understand it is a form of reactivity. Talking about it is a form of reactivity. It's much better to build a direct conscious relationship with it. That is what really promotes healing. The second thing that we focus on in great detail during mindfulness therapy is looking at the internal imagery of the emotion. And this may be a new concept to you, but if you think about it, you will begin to realize that all emotions are based around imagery. That's why we used image-based language when we talk about our emotions. We might say, for example, I feel overwhelmed by my anxiety. That tells you right there that the internal imagery of that anxiety is very large. It has to be very large in order to overwhelm you. It probably is seen higher in your visual field, that's seen above you. It's not going to be on the floor. So our language points to the internal psychological imagery that actually provides the structure to the emotion itself. Now, seeing that imagery is really, really important, because when you can see it, then you can begin to change it. And when you change the internal imagery of an emotion, you change the emotion. So this is a very effective part of the healing process, helping to change the imagery of the emotion. In the case of traumatic memories, this is precisely how they heal, how we get over the traumatic memory. It's because the imagery changes over time. It's often very slow to change if we're allowing it to change naturally, but if we focus conscious awareness on that imagery and directly help it change, then it heals a lot quicker. So that's another major part of mindfulness therapy. So if you'd like to learn more about online psychotherapy via Skype for your anxiety, do please email me and tell me more about how I can help you. And then when you feel ready, we can schedule a session. You will see in the very first session just how powerful this approach can be. And most people see changes after the very first session when you start applying the mindfulness methods that I will teach you on how to work with your anxiety. That's the goal of this teaching, is to give you the tools to manage your anxiety and to heal it. So please contact me if you'd like to get started.